Low-carb diets and pregnancy. What are the effects of a low-carb diet on pregnancy? Low-carb diets can be used to improve fertility, manage adverse symptoms during pregnancy, and even healthfully lose weight while breastfeeding. There has not been a voluminous amount of research conducted on the effects of low-carb diets and keto on fertility, pregnancy, and breastfeeding. From what little research there is and a small amount of anecdotal evidence, what one can discern is that low-carb diets can improve fertility, are okay during pregnancy, can help manage gestational diabetes, and that a moderate low-carb diet 50 grams a day is okay while breastfeeding. That's good news for women who want to exert greater control over their own health and well-being. The keto diet is used to treat polycystic ovary syndrome. PCOS is a constellation of symptoms caused by elevated male hormones in women. Some examples include menstrual cycles that are irregular or non-existent, ovarian cysts, sleep apnea, increased hair growth on the face and body, and decreased fertility. PCOS is a common condition, with one study revealing that it's present in 12 to 21% of women of reproductive age. Up to 70% of women with PCOS remain undiagnosed. In 2005, the effects of a low-carbohydrate, ketogenic diet on PCOS were documented as positive, helping participants manage their weight and decreasing the amount of male hormones in their bodies. In 2017, the journal Nutrients published The Effect of Low-Carbohydrate Diets on Fertility Hormones and Outcomes in Overweight and Obese Women, a systematic review, which offered even more evidence that the ketogenic diet can be used to manage symptoms of PCOS. These studies, however, did not touch upon the effects of a low-carb, ketogenic diet on the fertility of women who don't have PCOS. However, according to the Office on Women's Health, which is a part of the U.S. Department of Health and Human Services, being overweight may prevent ovulation because fat cells release estrogen. The thinking goes that if you have enough fat cells releasing enough estrogen, that they'll release enough estrogen to prevent ovulation and menstruation. A moderately low-carb diet may be okay while breastfeeding. Keto and breastfeeding are not an advisable combination, so mothers will have to change their keto lifestyle a little bit. If you want to eliminate unhealthy, carb-heavy foods from your diet in favor of nutrient-dense foods, and maybe even reverse weight gain while breastfeeding, 50 grams of carbs is the number most often suggested. 50 grams is even the amount used by Atkins. In a blog titled, "Oh, Baby! How to Lose Baby Weight with Atkins," Colette Heimowitz, MS, Director of Education and Research for Atkins Health and Medical Information Services, wrote, "You should be able to lose weight gradually while breastfeeding by keeping your daily carb consumption around 50 grams of net carbs or above. Nursing a baby requires a reasonable amount of calories, so you should see a gradual weight loss. The issue is that too rapid a weight loss, combined with the concomitant release of toxins stored in fat cells, might also be transmitted into breast milk. Until you wean your child, losing only 1 to 2 pounds a week should be your goal. To have adequate milk supply, it's essential that you're staying well hydrated. Low-carb, high-fat diets have a diuretic effect, so it's also a good idea to drink fluids and replenish your electrolytes regularly. It's also important for mothers to remember that a high-fat, low-carb diet's appetite-dulling effects may lead to a diet with insufficient calories. This can be remedied by adding some fruits to the diet so that a drop in glucose levels triggers hunger. And even though you may know what you need to know about intermittent fasting, it's not something you should practice while pregnant or breastfeeding. Above all else, it's important to stay informed because the effects of low-carb and ketogenic diets during pregnancy are still being researched in both formal and informal settings.